Well, when I first found out I had scoliosis, I was in my early 30s. And for my job, I needed to go get a physical. And the doctor said, "You have scoliosis." Well, I didn't really think too much about it because I really didn't have a lot of pain. So I just kind of dismissed it. I'd go to the chiropractor once in a while when I would hurt. But then when I got in my 40s, then I started getting more pain. And I decided I was going to go have it seen. So I went to a specialist in Indianapolis. But he pretty well said, "You're not quite ready for surgery. We'll monitor you. And when you're ready for surgery, we'll put a rod in your back and we'll just wait." Well, he also said that type of surgery is difficult for the patient and difficult for the surgeon, and then I would lose my mobility probably.
When scoliosis becomes severe enough or debilitating enough, it warrants the risk of having something called scoliosis surgery, which involves fusion. Fusion is exactly what it sounds. They actually fuse bones that are supposed to be moving, and they fuse them into one bone. If it was two bones being fused into one, we're affecting a small ability of your spine. But most scoliosis cases are getting fused multiple levels, 4, 5, 6, 7, 8, 9, 10, even 12 levels of the spine. So that whole section of the spine is being completely fused together. Therefore, the person is going to lose mobility associated with that area that's being fused. That lack of motion can lead to other things, especially as you get older, because we know once patients have the ability, they lose the ability to move and walk. Unfortunately, that increases mortality rates and all types of other things that we don't want to deal with. So it's a big risk, especially as you get older when you deal with scoliosis patients and scoliosis surgery. So it's something that you want to avoid if it's all possible.
Well, my husband, his name's Richard, he started searching on the computer, and he came across Dr. Tony. And at that time, we contacted them. And from then on, I feel blessed. They made such a difference in my life because they helped me to get a plan, exercise plan. They designed a torso trainer for me, and it just made such a big difference. Between the intensive therapy, the torso trainer, and the exercises, I just felt like I could keep going. Well, when I first came, I was afraid because intensive therapy was scary. But once I started working on the machines, it wasn't uncomfortable, and they made it so easy, and it made me comfortable, so I was able to do it. I was excited about that.
When somebody's in pain, typically what they're scared is they don't want to aggravate it, right? They don't want to do anything that's going to make it worse because they move, they sit wrong, it makes them worse. They walk wrong, it'll worse. They do some gardening on the outside, it works. So they're scared to worsen it, and they think if they do therapy or exercises or rehab, especially in the way we do it, where we take this long program, we make it a short duration, they think it's, oh man, this is going to be extremely painful, and I don't want to go through that kind of pain. It's not worth it. Well, the truth is that our care isn't painful. Our care is actually very, very relieving to the spine because we're actually straightening out the spine, making it less pressure on the nerves. But one thing we do is we decompress the spine, we elongate it. And this is an elongation that actually almost reverses the time of gravity that's had on the spine over these years that creates all the pain. So we're actually elongating it. And what we know is that we've done a study, and we actually did 5,000 patient visits, and we actually looked across at multiple offices, not even my own clinic, using very similar techniques. And they filled out questionnaires of how patients felt as a result of their care. And the worst thing that people felt was exercise soreness. They felt a little soreness after like they worked out today. So we know that patients come in our office and they're not going to get worse as a result of our care. If anything, they're going to be a little sore like they worked out, but more likely they're going to feel better.
My results from coming to Dr. Tony have been remarkable. My curve was in the upper 50s. And through the intensive therapy and all that they've done for me, I've reduced it down to in the 30s, and I'm able to maintain it there. So that means no surgery.
Once we get below 40 degrees, we can eliminate the risk of surgery. The doctors wouldn't like to do surgery, but if the person is still experiencing pain, well, what good are you really doing? Just reducing a number. But if you can reduce the number and get them functioning better and improve their pain and get them feeling better and doing things that they couldn't do before, well, now, yes, you're not only reducing it out of the threshold in terms of size, of curve, but now you're also making them more functional. You're actually getting both things accomplished, right? And that's where our results truly shine.
When I look back at my story and when I went to a specialist and they told me just wait and see, but at that time they did not give me any exercises, really no hope, other than we're just going to wait. And when you get to a certain point, we're going to put a rod in your back, and then you're going to not have any more, but you may lose your mobility. I wish I would have known about Dr. Tony then, and then I would have had that hope, something to keep going. I needed exercises, I needed a torso trainer, I needed help, and I wish I would have sought that out, but I'm glad that I found Dr. Tony.